with Small Things Dance Collective, which is my organisation I have in collaboration with Kath Hawkins, we do a research project into movement and dance at Alder Children's Hospital, and we're in our 7th year now. So the research has evolved out of our experience of working there as artists, and we did a qualitative study in 2008-2009 on the oncology and neuromedical wards, and then over the last 2 years we've also created film documentation, and we also done a quantitative study on cardiac, orthopaedic and neuromedical wards as well, measuring the effects of our practice on children who have acute pain. Prior to being here at Edge Hill University as an artist, I was invited in to experiment a little bit with movement and dance. I was the first dance artist in residence at the hospital, so it was really experimental and a question of whether this would have any effect within the context of the arts and health programme that they have at the hospital. So they already had other art forms working there, and I was invited in as a dance artist. And for me, as a dance artist, my interests are really in working outside of theatre, in unusual spaces. So to be able to work somewhere like a hospital with the kind of improvisation approaches I use was like an amazing opportunity, which I took. And the work was just really successful straight away. There was a big impact for the patients and for the staff, so it's just kind of naturally evolved from there, really. It's amazing to be able to do that in that context, and as a parent myself, I kind of really value being able to make life a little bit easier for the parents as well. So because we've been there for such a long time now, and this has become kind of part of the ongoing treatment of a lot of patients who are, particularly ones who are long term, that it's a space for the parents to really be able to see their child happy and exploring creativity, when often a lot of the time they don't have a lot of choice about what they do. So it's a space for them to be a child and a young person really, and express themselves, but at the same time it also has these kind of benefits which are associated with their healing and their treatment as well. The benefits of the work, the immediate benefits are of course for the patients, the children, the young people we work with. We've seen children move from being in acute pain to kind of relief from pain. We've seen children who've been withdrawn and a little bit depressed move into play and expression and dance. So they're really immediate benefits that we see with the work, and then that has like an immediate impact on their families and their carers around them, but also on the clinical staff, because children who are long term on wards and experiencing difficult treatment, we work with children who are having open heart surgery both before and after their surgery. Obviously, if they're in a less anxious place, that makes that easier for all the clinical staff to do their jobs as well. But for me, there's a huge benefit to me as an artist, because I work with improvisation, and it's the context when I feel like I'm really at the cutting edge of my own practice, because I really don't know what's going to happen next. There's a lot of unpredictable things that happen within the hospital with a child's condition, but also you might be working in a particular way and you need to adapt that because a consultant comes in or a doctor comes in, or you're working alongside a physiotherapist. So you can't really plan a session in a way that you normally would, but I really enjoy that, and I feel like it's the place where I can really be the artist I want to be. So that's really enriching for me as well. I feel like I get just as much back as an artist as I put in for the children as well. And I think that kind of resonates with other artists who are interested in doing the work as well, that they can kind of, you know, sometimes people ask me, oh, it must be really difficult, but it's actually the place where I come out of work and feeling the best, the happiest, I suppose. So I do hope that other artists get the opportunity to do it as well.